Greetings again. This is Dr. Hudgens, and we will now be reviewing Chapter 25 from this unit. We'll explore a little deeper into occupational therapy's role in primary health care settings. Again, this is from Chapter 25, and this is from our textbook, Occupational Therapy in Community and Population Health Practice, 3rd edition. By the end of today's session, the participants should be able to describe primary health care, including the types of providers, the settings, and populations, discuss the most commonly addressed prevention and health promotion issues in primary health care practice, discuss potential roles for occupational therapy in primary care settings, explain the impact of health literacy on the individual health and strategies for addressing the problem of health illiteracy, and describe evidence-based practices that can be integrated into primary care. So what is primary care? Primary care is defined as the provision of integrated, accessible healthcare services by clinicians who are accountable for addressing a large majority of personal healthcare needs, developing a sustained partnership with patients, and practicing in the context of family and community. So, as we explore OT in primary care, the occupational therapist in this setting definitely needs to practice as a generalist. They would provide services across the continuum. This includes all age groups, all varied diagnoses. Typically, it provides a short and brief intervention method. They assist with chronic care management. The occupational therapist is a member of the interprofessional team. And as I said earlier, they provide care across the lifespan. So the occupational therapist in primary care would be able to address someone who has a pediatric need and or someone who is at, end of life or geriatric need. So who is on the primary care team? The primary care physician is defined as the physician whose practice includes the provision of medical care for well individuals and who acts as the gatekeeper to specialist services. Typically, it's the primary care doctor who will make that referral to a specialty as needed. Oftentimes, the PCP is a family medicine doctor, an internal medicine doctor, a pediatrician, an obstetrician or gynecologist for women in primary health care, and a psychiatrist for primary mental health services. Also, physician extenders are a part of the primary care team, and this includes nurse practitioners and physician assistants. So the primary care team is often referred to as the medical home, where everything takes place for that patient. It focuses on the patient's physical and mental health care needs. This includes prevention and wellness, acute care, chronic care, and that medical home team can and usually will include the physician, advanced practice nurses, physician assistants, nurses, and now we're seeing more occupational therapists, pharmacists, nutritionists, social workers, counselors, educators, and care coordinators. As we explore primary care, one of the goals in primary care is health promotion. And this is defined as enabling people to gain greater control over the determinants of their own health. OT and health promotion, it is our job to promote healthy lifestyles, support occupational participation for health, and provide intervention for populations. So we must be able to encourage our patients to explore options for a readiness to change. Patients and clients must be ready to make this lifestyle change. And this is often referred to as the trans-theoretical model or a stage of change. Basically, it is our role to bring that risky behavior to the person's attention, help the person to determine the need to change, and then facilitate the decision to change and select the strategies for change. maintain and reinforce those new healthy behaviors, and then reinstitute the healthy behaviors when lapsing into old patterns and behaviors. So, as an occupational therapist, we assess the person's health promotion needs, we provide health education, we assist the patient in setting realistic health goals, and we assist individuals and their families to integrate health behavior changes into their daily lives. We facilitate access to and use community resources and provide patients with that information, enabling them to be successful in their healthy lifestyle changes. And then once we implement those changes, we evaluate the outcomes through follow-up visits and or contacting that patient. It could be having them come back into the primary care center and or doing a telehealth visit for follow-up. As we explore chronic disease management, in primary care, a priority is chronic disease. And what we're seeing mostly within this realm is type 2 diabetes, obesity, chronic pain, particularly low back pain, and mental health. As an occupational therapist, we can help that patient focus on self-management, lifestyle modification, and then for the client who has mental health conditions, they're also often seen in primary care. So we can address those physical health issues. Usually those diagnoses include depression, anxiety, substance abuse, eating disorders, and post-traumatic stress disorders. When we talk about integrated care, let's define integrated care. It's defined as blends the expertise of mental health, substance abuse, and primary care clinicians with feedback from patients and their caregivers. And it's a team-based approach. So the occupational therapist can commonly do what's called brief office interventions. We target a risky behavior identified by the patient, complaint, and or through their medical or social history. That's the assessment. In the advisement section of this intervention, we emphasize the importance of discontinuing the risky behavior, the improvements that can be gained in health status, and the willingness of the healthcare provider to assist the patient in making the needed changes. It should be clear, simple, and personalized, advice provided in a warm and empathetic, non-judgmental way. And then the final step in this brief office intervention is to agree, to have collaboratively design and agree upon a course of action to change the targeted risk behavior. Assess the patient's readiness to change and design interventions accordingly. Then also another step is to assist. We provide specific behavioral interventions, encourage and facilitate follow-up counseling and health education sessions, assess the effectiveness of the physician's provided the medications, and determine if it's helping in the behavior change. And then arrange as needed, reinforce positive changes, revise intervention plans if necessary, provide ongoing follow-up and support by telephone, electronic communication, or other office visits. As we explore primary care and healthcare promotion, we have to consider healthcare literacy. This is defined as the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health care decisions. So, in implementing intervention, we need to assess the health literacy. It needs to be created and provided in a way that's culturally relevant and has plain language. Health information sessions need to be available on a variety of topics. Health counseling should be available, and we need to provide in-person and online self-help and support groups as needed. A big part of health literacy should include patient education on preparing for and participating in healthcare interaction with providers. We must assist patients with their medication management and provide patient education on how to assess the relevance, quality, and credibility of the health information, particularly on the internet. As we discuss chronic disease self-management, some of the self-management strategies may include individual and family participating in the healthcare process, encouraging the patient to self-monitor their symptoms or their physiological process, assist the client in making informed decisions about their health, and manage the impact of the disease on their daily lives. So best practices for self-management include patient-client focused intervention, providing peer support groups, being available to provide feedback on the client's progress, address any psychosocial concerns, and be an active member of the healthcare team. For assessing health risk, this is called a health risk appraisal. This is the assessment that profile an individual's factors and estimate the probabilities of manifesting certain diseases. So this needs to include health education and counseling, caregiver education, and training. This would also include phone call follow-up, support that patient, encourage compliance with care plans, identify barriers to health behavior change, do home visits when necessary, and again, follow up with those brief office interventions as needed. So in talking about the steps to health promotion in primary care, the first step is program planning. Look at what are the needs of that primary care center and plan. This could be based on gathering information from the electronic medical records from that facility, looking at the client base for that particular care center. After you do that, you would do a needs assessment. And we will definitely be exploring needs assessments throughout the course of this semester. Once you do a needs assessment, you would establish protocols for patient care. For the occupational therapy practitioner, you may want to consider using the COPM in doing this assessment. Step 4, we need to identify reimbursement and funding sources. And step 5 is to pilot and evaluate. Electronic health records provide good data for us to look at the metrics and the impact that we're having on that primary care center. It's very vital that we market occupational therapy services for primary care. This includes us educating the providers, the team, the administrators on the benefits, the value that occupational therapy will bring to the table for the team as well as the patients. And then also discuss OT outcomes. Referrals to occupational therapy for health promotion can save provider time. It can improve patient outcomes and can also lessen the need for medications and improve better compliance with self-management regimens. Mental health identification and potential intervention also needs to be discussed as you market occupational therapy in primary care centers. Explore the detection of performance deficits that may affect safe participation in everyday activities, and also explore early identification of patient lack of adherence to medical treatment plans, thereby preventing secondary complications of medical conditions. Once we've provided those services and we've marketed those services, we also must consider funding for occupational therapy services in primary care. This commonly can be billed through traditional billing mechanism utilizing CPT codes to bill for those services. One may also consider pursuing foundation grants or fee-for-service plans. Health maintenance organizations may also reimburse for occupational therapy services, and then workers' compensation for the injured worker certainly would reimburse for our services. So in summary, occupational therapy has an emerging role in primary care. This may include chronic care management,